As the date draws nearer for the imminent move of the Victoria Hospital, Nursing Director Ruth Regis Adesanya advises the public that come Friday, March 27th, it won't be business as usual.
So on Friday morning, we're going to move all our inpatients from 8 a.m., starting at 8 a.m. As such, there are a number of measures we've had to put in place. We've put in place to facilitate a smooth move of our patients. From visiting time on that day will be limited to from 6 a.m. to 7 a.m. only. There will be no visiting time again for that day. The normal visiting hours will recommence on Saturday. Additionally, our maternity patients who would normally seek care, the pregnant patients who would come in, we will still receive these patients even while we're moving the patients, but up till 12 noon. From 12 noon, the maternity unit at Victoria Hospital closes down, and so any pregnant patient coming for care would have to go straight to the Owen King EU Hospital. It's extremely important for everybody to note that. From 12 noon, the maternity ward at Victoria Hospital is shut. For accident and emergency, or what is commonly called casualty, we will continue to give care within that facility, that unit, until 4 p.m. on that day. So from 4 p.m., the accident and emergency or casualty unit at Victoria Hospital is closed. During that 8 to 4 period, St. Jude Hospital will be giving us some assistance, and so there is the possibility that some persons may be redirected to the St. Jude Hospital based on the presenting situation.
The public is further advised that due to the COVID-19 pandemic, certain protocols have been put in place for the protection of staff and clients of both OKEU and Victoria Hospital. Medical Director Alicia Eugene Ford explains.
The Victoria Hospital will become the respiratory hospital. At that hospital, we're only asking persons with respiratory illnesses to come to that hospital. So we're looking at persons with the flu-like symptoms, with asthma and other respiratory illnesses to come to the Victoria Hospital. At that particular point, an initial review would be done, a pre-screening. If we realize at the pre-screening that there's a non-related or it's not a COVID-related case, you'll be diverted or sent or redirected to OKUH, which is a general hospital. But if you do have COVID or any symptoms or signs related to COVID, then we will take care of you at that particular hospital. This particular hospital is not working in isolation. We'll be working along with our primary healthcare department, where we already have respiratory clinics in the primary healthcare department. So we're working along these clinics to make us work at a national level so we can actually work together to combat COVID-19.
The move of the Victoria Hospital involves strategic and meticulous planning. The actual move began over a week ago with the transfer of several vital pieces of equipment and supplies, staff orientation and training, including the preparation of the various units. The move, however, is expected to intensify this week and culminate in the transfer of inpatients to the Owen King EU Hospital. Reporting for the Ministry of Health and Wellness, I am Glenn Simon.